Imagine two people. Same age. Same city. Same disease. One of them gets diagnosed on a Tuesday morning, calls their doctor that afternoon, sees a specialist by Thursday, and starts treatment the following week. The other one Googles their symptoms for 3 weeks because they are scared of what the bill might say. They finally go to the ER at 2 a.m. when they can't take it anymore, and they walk out 6 hours later with a $28,000 bill and a payment plan they'll be on for the next decade. Same disease. Completely different outcomes. And here's the part that nobody wants to say out loud. The difference between those two people wasn't the doctor. It wasn't the hospital. It wasn't even their health. It was money. In America, the quality of healthcare you receive is almost entirely determined by what you can afford. And most people have absolutely no idea just how wide that gap actually is. So today, we're going to walk through every single level of American healthcare, from $0 all the way up to $1 million, and by the end of this video, you're going to see the system in a way you've never seen it before. Here's what most people believe about healthcare in America. They think it works like this: you get sick, you go to the doctor fixes you, and you pay whatever you owe. Simple. Maybe expensive, but simple. And there's a psychological reason we believe this. It's called the availability heuristic. We base our assumptions on what we've personally experienced or what we've seen around us. If you've always had decent employer insurance, you assume that's just how healthcare works. You go, you get seen, you pay a copay. Done. But the reality is that American healthcare isn't one system. It's about 8 completely different systems, layered on top of each other, where the quality of care you receive changes dramatically based on a single variable: how much money you have access to. And here's what makes this psychologically dangerous. Most people don't discover which system they're actually in until the moment they need it most. When they're scared. When they're vulnerable. When they have absolutely no power to negotiate. That's when the bill arrives. So let's break it down. Level by level. Level 1, $0. The uninsured ER visit. You have no insurance. No money. But something is wrong and you can't ignore it anymore. So you go to the emergency room. And here's the thing: by law, they have to treat you. There's a federal rule that says any emergency room receiving government funding must stabilize any patient who walks through the door, regardless of their ability to pay. So you wait. Maybe 4 hours. Maybe 8. You see a doctor for 11 minutes. They run some tests. They tell you what's wrong. They discharge you. And then, 2 weeks later, a bill arrives. It's $28,000. Some hospitals have charity care programs. Some bills get negotiated down. Some people just never pay, and it goes to collections. But here's the psychological trap: the anxiety of that potential bill causes millions of Americans to avoid going to the doctor at all, even when something is genuinely wrong. They wait. They Google. They hope it goes away. And sometimes it does. And sometimes it gets dramatically worse. The $0 level isn't really free. It's just the most expensive form of procrastination in existence. Level 2, Medicaid, the safety net. If your income falls below a certain threshold, roughly $20,000 a year for a single adult in most states, you may qualify for Medicaid. And Medicaid is genuinely good coverage. It covers doctor visits, hospital stays, prescriptions, mental health, and more. For many people, it's free or nearly free. But there's a catch. Not every doctor accepts Medicaid. Finding a specialist can take weeks. In some rural areas, the nearest accepting provider is an hour away. The coverage is real, but access is inconsistent. This is the system roughly 85 million Americans depend on. And most of them didn't choose it. They just ended up there. Level 3, $500, the cash pay patient. This is actually smarter than most people realize. If you're uninsured but not destitute, you can walk into an urgent care clinic and pay cash. A visit costs around $100 to $150. No appointment needed. Seen within an hour in most cases. Then you use a discount prescription service to get generic medications at up to 80% off retail. You get basic blood work done at a direct lab for $30 instead of $300. You manage your health like a smart consumer, shopping for care the way you'd shop for anything else. It's not perfect. It doesn't cover emergencies or surgery. But it's a genuinely functional system if you're relatively healthy and financially disciplined. Level 4, $6,000 a year, the ACA Marketplace. This is where most people who don't get employer insurance end up. A decent plan might cost $300 to $600 a month after subsidies. But here's where the psychology gets interesting. Most people pick the plan with the lowest monthly premium. It feels like saving money. But those plans come with deductibles of $6,000 or $7,000, meaning you pay all your medical costs out of pocket until you hit that number. This is a classic example of present bias, optimizing for the cost you can see right now, and ignoring the much larger cost that might hit you later. Level 5, $25,000 a year, the good employer plan. This is what people mean when they say they have good insurance. Top-tier PPO through a large employer. Low co-price. Manageable deductible. And here's the key difference, you can see almost any specialist, usually within a week. This is the level where healthcare actually starts to feel like healthcare. You get annual physicals. You catch things early. You don't avoid the doctor because you're afraid of the bill. But it's worth noting that coverage is tied entirely to your job. Lose the job, lose the insurance. And the psychological weight of that fact influences career decisions for millions of people every single year. Level 6, $100,000, the crisis patient. You have good insurance. But then something serious happens. Cancer. A cardiac event. A major accident. You're covered. But covered doesn't mean free. You hit your out-of-pocket maximum. Then come the indirect costs. Time off work, travel to specialists, medications not covered by your plan, home care, rehabilitation. Serious illness costs the average insured American family tens of thousands of dollars above what insurance covers, when you factor everything in. This is the level where even good insurance reveals its limits. And this is why medical debt is the leading cause of personal bankruptcy in the United States, even among people who are insured now. Here's the deeper idea I want you to sit with. Everything we've talked about so far, the waiting rooms, the deductibles, the surprise bills, all of it exists because in America, healthcare operates like a product. And like any product, what you get is proportional to what you pay. But here's where it gets psychologically fascinating. Most Americans know the system is imperfect. And yet, the way we respond to that knowledge is almost entirely determined by where we currently sit in it. If you have good insurance right now, you feel protected. You feel like the horror stories don't apply to you. Psychologists call this optimism bias, the belief that bad things happen to other people, not to us. And that optimism bias is exactly what the upper levels of this system depend on. Level 7, $300,000, concierge medicine. At this level, you pay a private physician a retainer, anywhere from $10,000 to $40,000 a year, and in return you get something most Americans will never experience, a doctor who actually knows you. Your doctor has 50 patients instead of 2,000. You can call them directly. Your annual physical takes 3 hours, not 15 minutes. They catch things early. They prevent problems instead of just treating them. This isn't exotic medicine. It's just medicine the way medicine is supposed to work. The problem is it costs as much as a luxury car, every single year. Level 8, $1 million plus, executive and ultra-wealth healthcare. At the very top of the pyramid, healthcare becomes something else entirely. Major health systems offer executive programs where you spend 2 or 3 days getting a comprehensive evaluation, advanced imaging, genetic testing, cancer markers, cardiovascular screening, for $5,000 to $15,000 out of pocket. The ultra-wealthy access experimental treatments unavailable to the public. Private hospital floors. Dedicated nursing. Medical evacuation insurance that puts them on a private jet to the world's best specialist within hours of an emergency. And increasingly, longevity medicine, the science of actively slowing the aging process, is becoming a serious pursuit at the top. Annual cost, $100,000 to $500,000. Goal, not just more years, but better ones. So what do you actually do with all of this? First, understand which level you're actually in. Not which level you think you're in. Read your insurance plan. Know your deductible. Know your out-of-pocket maximum. Most people have never read their health insurance documents. That is a financial literacy gap with potentially catastrophic consequences. Second, build a dedicated healthcare emergency fund. Not just a general emergency fund. A separate account specifically for medical costs. Start with $3,000. Work toward your annual out-of-pocket maximum. Because the one thing every level of this system has in common is this: when something goes wrong, you will be charged money you did not expect. Third, close the preventive care gap yourself. The biggest difference between level 5 and level 7 isn't the emergency treatment. It's the early detection. Patients with thorough annual care catch cancer at stage 1. Uninsured patients often catch it at stage 4. The most powerful thing money buys in healthcare isn't better treatment, it's earlier treatment. You can close some of that gap by being disciplined about checkups, blood work, and screenings, even if your plan makes it slightly inconvenient. Here's the thought I want to leave you with. The two people I described at the start of this video, same age, same disease, they didn't have different outcomes because one of them was unlucky. They had different outcomes because the system responds differently to different bank accounts. Your financial decisions, how you build wealth, how you invest, how you protect your income, they are not separate from your health. They are directly connected to it. In America, your financial position is, to a degree most people are uncomfortable admitting, a predictor of how well you are treated when your body fails you. Which means every good financial decision you make, every dollar saved, every investment compounded, every unnecessary expense cut, is not just about retiring early or buying a nice house. It might literally determine what happens to you the next time something goes seriously wrong. Think about that the next time someone tells you personal finance doesn't matter.